Okay, so we've got Mr. Bongos here. Just going to do a quick little light wrap around the neck and then leaving a spot open on the back there because that's where we're going to put our fluid injections. So we've got a clean needle here. The way you change your needles is you unscrew that little handle there. They come apart, make sure it's clean and you don't touch the ends together when you're putting your needle back on, changing your needles. We've got a nice bag of needles there to change for every time you're given fluids. So first thing you do is you pinch, make a nice big tent over the back like this, and gently insert the needle. I know, bud. Good job, honey. Okay, and you can let the skin kind of relax. You always want the needle kind of pointing towards their head so that if they jump, it's not going to hurt you or him. And then there's a little wheel device here on the line from the fluid bag into the needle. So you just roll that up, and sometimes you need to move the little stopper off of that area and give it a little pinch so that it flows well. And it's hard to see on the video, but in real life you'll see little drips from that chamber, and you've got marks down the side for what volume you're giving. He's going to get 150 mLs once a day. So we're going to do his first dose here. You get little half marks here in between the numbers. That's your 50 mL. So I'm going to give the bag kind of a gentle squeeze so that it goes in a little bit quicker. And he's being a champ. They can be a little bit more jumpy when they're at home in a more familiar environment. So you might need to kind of gently cover his eyes so that he doesn't jump forward when you're giving the bag a squeeze. One other thing that you can do when you're giving the fluids to help it be a little bit more comfortable for him is you can warm this bag up in a sink with some warm water, but do test that water first. Do test the fluids first on the inside of your wrist, just like you would with like a baby bottle, to make sure it's not too hot. It should just be lukewarm, and that can help it be a little bit less uncomfortable for him. So you always want to, when you're checking how much has gone in, you always want to kind of do it from a hanging position, because that's the most accurate way that is measured on the bag there. And you'll see, you can watch in the drip chamber there at the top of the line, right where that comes out of the bag. You can see how that's flowing into the skin, the space under the skin. And you can see too on the video that little bubble growing slowly as we push the fluids in. You want to make sure that you do see that bubble come up, because otherwise it's probably running out down the side of him, because it can be sometimes easy for that needle to either slip out or for it to go through. And if that happens, it's okay, no big deal. Just replace the needle and maybe hold it, have someone help you hold it there if you are having issues with the needle staying in place. Okay, so I'm going to double check where we're at. All right, so we're about 50 mils in, so we're a third of the way there. It is a pretty large volume. Rabbits have a really, really large need. They have a really high fluid need rate, especially compared to us and to cats and dogs, because of their diet being mostly, or being pretty much all grass and being all that tough fiber. They need a lot more fluid for their maintenance needs. And when they are sick, like with stasis, their fluid needs go up even more. So it is a pretty big volume, but that's because that's what he needs in order to get better. So it takes a little bit of patience to do the fluids with him there, but he's being a really good boy for us. You gotta be good for your mom when you go home, huh? So we're about 100 mils in right now, so we're almost there. Give another good squeeze, and it's not perfect. You know, if you can get to 100, 125, and if he's getting really jumpy and really hard to restrain and give the fluids to at home, when you've hit, when you're getting close to that 150, the difference between 20 or 30 mils is not going to make or break him. We also don't want to get him too stressed out from getting the fluid treatments too. So it's a balance. It's definitely a balance. All right. Let's see where we're at. Got maybe 25 more mils to go, so another big healthy squeeze here. And that fluid bubble that you see, it's kind of starting actually to slide over to the side towards us here. So if it shifts, that's totally fine. That's normal. That'll happen. No big deal. And you can put a lot of pressure on this bag. Don't worry about squeezing it too hard. All right. So we're now down to have gotten 150 mLs of the fluids. What we do next is Devin's just put her thumb kind of right over where the needle is going to come out. So I'm gently going to slide that out. She's going to hold some pressure there for us. Close off your little wheel, usually before you take your needle out. And Devin's just holding a little bit of pressure there to make sure that the fluids stay in. You can't have a little bit of leakage of fluids out of where the needle went in. That's totally normal to happen too, but just putting a little bit of pressure there for about 20-30 seconds helps keep that all in place. And then the next time that you go to do your fluids, you take one of your clean needles, and there's a little cap there. I'll show you. So you're going to go home with a line that has a clean needle on it. So you just twist that off, and that's the end. You want to keep clean and don't touch. Hi, Bongos. I know. And then, again, you just are going to unscrew this bit. Keep it clean. This one's dirty, so nothing. We don't care what happens to that one. You can drop that. Keeping these ends clean. Put them together. I know, honey. And do a little twist. Good boy.